All right, welcome everyone. Today's May 3rd. Hard to believe it's May 3rd, 2023. We are 3 years in from the COVID craziness. So welcome to this week's edition of Mountain Pacific Quality Health. It's worth a shot. And today we are lucky enough to welcome back a very special guest speaker from Hawaii, Nancy, who will be discussing further our emergency preparedness planning. So a continuation of our April presentation where Nancy joined us. I can't say it's spring yet. We have snow in parts of our region, snowing in Anchorage, Alaska today. So much for May Day. It may rain, it may snow. Happy May. All right, next slide, please. A few updates and reminders. I do want to share that we were able to update some resource tabs on our website, and I'll drop the link into the chat box, specifically with our Worth a Shot series. So now when you access our website under the Quality Improvement Tools and Resources for the nursing home, there is an individual tab that will say it's Worth a Shot series. So if you miss a series or presentation and you'd like to go back and reference those slides or listen to the YouTube recording, you can go straight to that tab now and pick up that link. So hopefully that's easier for everyone to navigate and find and retrieve some of those wonderful presentations. I will also, just as we're on the updates and reminders slide, just a side note, the CDC is continuing to work through updating resources and publications around the COVID-19 vaccine recommendation changes, those bivalent recommendation changes. So as soon as we receive that information, we will share forward with you guys. Next slide, please. As always, feel free to add your webinar topics or clinician ideas into the chat, or when you, if you wait till the end or actually throughout the presentation, if you click on that post-evaluation link, there's also an opportunity to add topic ideas to the bottom of that post-evaluation. We'll continue to meet every Wednesday, same time, same place. With that, we have a polling question for today. Do you have any mobile vaccine clinics planned in the coming weeks? I'm reminding folks, kind of a public service announcement, really take advantage of those mobile vaccine clinic partners, pharmacy partners, community partners, as it looks like there's going to be some changes to that third-party billing, and we don't know how that's going to affect some of that mobile vaccine clinic option that has been tremendous and super helpful in getting our residents caught up. So if you don't have anything planned, I would reach out and see if you can get something planned. All right, we can go ahead and end that poll. Thank you guys for participating. All right, next slide, please. Quick look at our weekly COVID-19 cases. Great news here on the forefront, continuing to see decrease in weekly cases, decreased trending in deaths, and decreased trending in hospitalizations. That vaccination rate, bivalent vaccination status is holding pretty steady. Next slide, please. Quick peek at our COVID-19 community transmission levels. Some good news here as well, as we continue to see some more blue signifying a low community transmission level in your county. So great news as we see some blue, more blue popping up, but also being mindful as school gets out and travel and vacation and tourism kicks up in some of our regions. I'll also just comment that next week, to prepare for the end of the COVID-19 public health emergency, can you believe it, next Thursday, the CDC will be transitioning to a little bit different surveillance model. They're going to continue to use many components and resources that formulate the COVID-19 tracker, but just know that It sounds like next Friday, the 12th, they're going to announce a more comprehensive method and summary of providing those updates for COVID-19 data tracking. So 3 years into using this data model, and boy, has it grown and expanded to include county, state, national, global data. They will be updating it. So next Friday, we will know more. So stay tuned. All right, next slide, please. So again, we're so delighted to welcome back a special guest speaker. She will be discussing Big Island dialysis, disaster preparedness. This is part 2 of a previous session that we hosted in April. So Nancy Bigler, Director of Operations with, and apologize, I don't know if I can pronounce this correctly, for Fresenius Kidney Care. Nancy, we're so delighted to have you back. Thanks for being here.
Thank you so much for welcoming me back, and I'm really excited to go into a few more details regarding resources available. And you pronounced Fresenius just fine. Thank you.
Thanks for being here.
Thank you. Next slide, please. All right, so just as a recap from our previous presentation, my clinics are located on the Big Island in Hawaii in the bottom right-hand corner there. And we have a large island chain and have limited resources as a result of being out in the middle of the Pacific Ocean, and we need to understand what our resources are and how to use them within our local communities in order to prepare our patients and our staff to manage through disasters and emergencies effectively. So next slide, please. So this is one of the organizations that our clinics belong to. It's the Hawaii Healthcare Emergency Management Coalition. This coalition supports all of our clinics and our hospitals and nursing homes on the islands in Hawaii to effectively manage disasters. We have regular monthly meetings with them, as well as doing monthly check-ins through the devices that they provided to us. And I'll go into more detail about those in subsequent slides. And they also provide a forum for us to be able to do a emergency tabletop drill as an entire state once a year. So it's an annual drill that we do, and it involves acute care as well as the nursing homes and the dialysis clinics, and all of the local healthcare agencies get together, and we all drill on the same emergency at the same time. And Hawaii Healthcare Emergency Management runs those drills and sends us all the information that we need to run those drills effectively, as well as providing the resources that we need to incorporate into those. So they're a wonderful resource for us, and I hope that each of you have a similar agency that's able to support you in your disaster events. This is a picture of their website. They've got their emergency operations portals, as well as their emergency links, so we can communicate with them directly through computers. So we can tell them, are we open, are we closed, what are our needs? So if we needed to evacuate, for instance, we could call HHEM, and they would support us to evacuate our patients to a safer area. Next slide, please. The communications is an extremely important piece of disaster management. We frequently lose communications through our computers and our cell phones. So having the opportunity to communicate with each other through other avenues is really important for us on the island. So we have a few different areas that we can access that do not require a cell phone or a computer. So we've got direct line to our healthcare coalition, HHEM, through our CDMA radios, as well as we have ham radio folks. We have walkie-talkies that are used locally, and we also have an analog phone that we can plug in to support us. If our computers are operational, we can use WinLink to communicate similarly with ham radio, as well as the healthcare emergency management site that I spoke of earlier. And we have a Fresenius Kidney Care disaster portal as well. Communications in person are particularly helpful. For instance, through our lava disasters, we'd had weekly community meetings where the local disaster team, civil defense, would get together with the communities, review, what's going on, where they predict evacuations are going to be necessary, and just providing support to the communities. We were able to support our local community by for those patients and staff that were evacuated as a result of the lava flow. Some people lost their homes to the lava, and so we were able to support them through providing hospital or hotel support, as well as bringing them supplies such as drinking water to these community meetings. At the community meetings as well, they had various tables set up where the insurance companies were there to provide the community members with how to log their concerns with their insurance companies for losing their house or losing parts of their land, and various tables set up for supporting, like the Red Cross, supporting the community through the disaster. Throughout all of the disasters, including COVID, we've been provided with daily updates from our healthcare coalition, as well as civil defense also provides daily updates. And then, of course, in our local dialysis communities, we have our daily staff huddles and provide staff with the information that they need, and they can support our patients by providing that same information to our patients. Next slide, please. So just a little bit about the CDMA phone. It's a small phone that can be used as an ordinary phone and has voicemail on it. Additionally, it's got a push to talk feature, so we can use it as a walkie-talkie, and we can also use it for texting. So this phone goes directly to HHEM, and we have a protocol to follow where we wait to see, because everybody is communicating to HHEM. So there's a protocol to follow, and we can communicate directly with them during any disaster or pre and post disasters as well. Next slide, please. One of the big advantages of Big Island is that we have a really strong ham radio group. They're located all across the island, and they provide regular courses on ham radio and prepare the folks for taking their ham radio exams. And ham radio is just one of the best routes of communication for us. It's extremely fast. Often our ham operators know about disasters or the status of disasters before we get the communications from Civil Defense or HHEM. And we're able to communicate very effectively over ham radio. And we have a very strong ham radio group at our clinics, and so they're able to talk to each other, discuss how to get supplies over, or how to support each of the clinics all over the island. So it's extremely helpful and useful, and I would highly recommend getting a ham group started in your areas if you don't. The actual radios themselves are very small, they're easy to use, and it doesn't require a lot of expensive equipment. The ham radios can, range from, $50 all the way, up to very expensive radios, but a $50 radio works just fine and can get that communication where you need it to be. Next slide, please. One of the patient resources that we provide to all of our patients, including our transient visitors that come over from other parts of the world, is the CMS guide for preparing for emergencies, and it's specific to people on dialysis. So this is an excellent resource for our patients, and it is an extremely comprehensive document, and it's got pretty much everything that people who are on dialysis would need to prepare them for an emergency. Next slide, please. So the importance for each disaster is to look at where our patients live. So we need to understand ahead of the disaster where each patient is residing. So not just their PO box where we can contact them through, but their actual physical address and contact information. And with that contact information, we also want to know where would they, which shelter would they go to, or would they have another do they have family members on other islands that they would go to, or on the island that they would go to, so that we are able to stay in touch and provide resources and support to each of the patients. So we utilize, for our dialysis clinics on Big Island, we utilize a system called MapLine, where we can place their addresses on the map. We can put our staff on the map, and that way in a disaster we can pull up and see where they're located, what roads around them might be closed or open, and be able to provide them alternate routes to get to the clinic, or provide them with information for their local emergency shelter that they can access, and provide just that communicate. And then we can also go out, we know where they live, so if we're concerned and haven't heard from them, we can actually send people to their location to make sure that they are doing okay. The emergency contact information, we if it changes, we want to know that information very timely. So we ask our patients to let us know if they've moved, or if their emergency contacts have changed. And so during the admission process, we get all of that information, and then we keep it up to date quarterly or more often. We definitely, look at updating that information if we know of a disaster that's coming, and make sure that we do have the exact address for them. So yeah, MapLine will help us with the roads affected. Also, Civil Defense, our local resource here, has excellent tools for letting us know which roads are affected as well. We want to understand their availability of utilities. Lots of our patients live off the grid, so have already got emergency power through generators. But those that do rely on the county power supply, we want to make sure that they have an alternate ability to store their medications. Lots of their medications require, or some of their medications require refrigeration. So we want to make sure that they have access to making sure that their medications are kept at the correct temperature. And of course, having clean water. We provide our patients with the local emergency shelters, and also we note which shelters we are able to, that may be able to have pets, or have a certain number of plugs. We discovered in one of our last disasters with a fire, there was a large brush fire. And we discovered that the shelter that the patients were at only had one plug for the entire shelter. And so it, was a competition for between cell phones and ambulance and the the CAPD plugs for the continuous ambulatory peritoneal dialysis treatment. So we're able to tell patients, you know, you may want to pick a different shelter in your area that actually has more than one plug for your needs. Food, our patients are on a very restricted diet and have very low need for fluids. So we provide them with an emergency diet plan. We also give them the shopping list that they would need to purchase all of the supplies for a 3-day diet plan, which they would be able to use for the full week in 6 days. So we give them the grocery list and encourage them to have all of that supply ready for any kind of an emergency. Next slide, please. So this is just an overview of the table of contents of that document, and you can see it's an extremely comprehensive document and talks about the what to include in their emergency go kits, as well as the grocery items that they need, and goes through when they need to shelter in place in their home and what to do if they do need to leave their home, and of course what to do if the dialysis facility is closed. Typically, if we're aware of a disaster coming, and you know, such as a hurricane, and we can see from the trajectory of the hurricane that our clinics are going to be affected, we will do a all hands on deck approach, where we have all of the staff come to the clinic and all of the patients are dialyzed over the next 24 hours. We'll run our clinics full 24 hours, get all of our patients at least one last treatment in order, so that they can be able to go without dialysis for, you know, 2 or 3 days, and enact their emergency diet plans. So, you know, we're fortunate when we do get that kind of notice, but we want our patients to be prepared for a disaster such as an earthquake, where we do not have that kind of ability to dialyze everybody in advance. Next slide, please. This is just a snapshot of the types of things that document provides. So a checklist for getting ready for disasters. And you can view all of this on their website. It's open and available for anybody to review. And so you can adapt it to your own local needs. And, you know, because it's pretty much essential information for anybody. But we want to make sure that our patients have followed the checklists and have all of these things in place, and so that they can get through a disaster without having any ill effects. Next slide, please. This is an example of the 3-day emergency diet shopping list. So you can see it's quite different from what patients that are not dialysis patients would need. So this is very specific to our dialysis patients and their dietary requirements. And so very much a diet plan that will support them to not get ill effects from you know, things like potassium overload and fluid overload, that would support them until they can be dialyzed at the next available opportunity. Next slide, please. This is an excellent resource that we give to all of our patients as well. It's the Emergency Preparedness Handbook from our Hawaiian Electric, and I hope that your local electric companies also have this available to you. It goes through community preparedness, and again, it has great checklists and resources for all of the community members to be able to, you know, have an idea of how to shelter in place effectively, talking about water and electric, and how to make sure that, you know, various gas lines are turned off and things when they don't have electricity. And it's a great example of a document that has, will reach out to the various community members, has different languages available, as well as one for the children of the community as well to be involved. So that's that Maka one down in the right hand side there with the little owl on it. So helping our children to be involved and hopefully allay some of their anxieties throughout the disaster. Next slide, please. This is HIEMA, preparing your family for emergencies. And so it goes through general, this is not specific to dialysis patients. And again, it might, it's available to you, whatever community you live in, and goes through a variety of resources, and is also available to you on the website, and has a great documents for planning for your children, planning for disabilities, and recovery plans for what to do afterwards. And if you've lost your documents, and if you're worried that maybe your food spoiled when your refrigerator went down. So please, please look at that if you have an opportunity, as well as the Go Bag checklist, which is really helpful for those that need to evacuate. Next slide, please. We're heavily involved with our Hawaii County Civil Defense Agency. They're an excellent resource for us. And so please look at your local partners for civil defense. They probably have something very similar to this. And they have the active alerts and maps, so we can see where roads might be closed, hazard impact maps where it can demonstrate where to go and where you might be affected, and volcano hazards. Maybe you don't have to worry about those. Next slide, please. This is an example of their website, gives a daily update and sometimes hourly updates depending on what the issues are. So it'll tell us, when our last earthquakes were, whether there was any tsunami threat for us to be aware of, and also goes through all those different alerts that you can see on the right-hand side. Next slide, please. This is a fantastic document. It's extensive. It covers everything, and it goes through projections. So, talks about dams that could be of hazard in our areas, and talks about, if it talks about mitigation for each of those areas and what the priority level is of those mitigation plans, depending on the hazard. Fantastic resource. I wish I had a chance to kind of go through some of it with you, but I would strongly recommend that this for anybody who's looking at making their disaster plans and looking at the different hazards, because it gives you lots of food for thought for thinking about what hazards you may not have even thought of. It's extremely comprehensive and extensive. Next slide, please. And then lastly, there's just a few of our local resources. For us, we've got multiple different disasters we have to be prepared for. So we've got the Tsunami Information Center website, the Hawaii County Volcano Hazard website, our Civil Defense Agency. Next slide, please. And the Hawaii County Civil Defense. And so the Hawaii County Civil Defense Agency has multiple areas that you can go to for preparing your families, your home, your business, as well as printable action plans. It goes through the hurricanes, flash floods, earthquakes, tsunami, and wildfire, which are the majority of the disasters that we see in our area. So if any of those pertain to you, you're welcome to look there and make sure that you feel covered.
So here's the thing though, is that some people have desktops still.
Next slide.
Well, don't we? I do. I'm mute, but I can't do my.
I think that's it for me. So I know I've covered a lot of
Yeah,
information and a lot of resources. I hope you get the opportunity to look at some of those and devise your emergency plans with a little extra help from these resources. And I really thank you for the opportunity to talk to you today.
Well, thank you, Nancy. And I did copy and paste the link to the go back
Chat.
checklist and put that in chat, and then the emergency plan template and put that in chat as well. So feel free to jump in there and snag that. Otherwise, you know, we'll send out the recording and all this information to all the attendees. All great information, Nancy. We sure appreciate it.
Well, thank you. And everybody stay safe out there.
Yeah, anyone thinks of any questions, go ahead and reach out. We're happy to help. And we did include the link to the post-presentation evaluation in the chat box. So thanks, great information. Stay safe, stay prepared, right? Is that the
Stay
message for
prepared.
today? Be prepared.
That's right. That's exactly right. Thank you so much.
Take care and be well, everyone, and reach out if you need anything. Otherwise, we'll see you next week.